Welcome to Nursing School Survival Guide Part 2. We are going to cover the rest of the survival tips. It's a total of 10 on the, let's see, yes, excuse me. Okay, yeah, there are a total of 10 survival tips, and I use these tips to complete my associates in liberal arts, my bachelor's in the science of nursing, and my master's in business administration. So yes, you can use these tips for any degree that you're pursuing. So I do encourage you to just keep that in mind. And I just really, kind of lean towards nursing because that's where most of my experience is. But I do want to welcome you. Thank you for taking the time to be here. I know you have plenty of things to do. I won't take up all of your time, and I really hope to stay on schedule. So, for the people that are going to nursing school, I do want you to know that you are strong enough, you are smart enough, and you are enough. So this is your journey. Own it and crush it. Let's see. Part 1 was recorded last week and it's on my YouTube channel, Jamesha Ross RM, but it has a very rough beginning. And the other thing I want to say is I have several things going on right now. So this class, the survival guide the survival guide is free, and I'm working on an ebook that will go along with it, but we'll have more detail. That should be ready in 2 weeks. And I'm working on my 30-day online class that starts tomorrow. Whoop, whoop. I'm so excited. It's my first class. It's a 30-day online course that is called From Survival Mode to Living Your Best Life. It does have a fee, but it's affordable because I know the struggle. But it's for people that are really serious about getting to the next level in their life. This class is for people that feel stuck and want more in life, and they want to stop the habit of procrastination and end the vicious cycle of poverty. They want to feel fulfilled, and they want to build a legacy that inspires others. Because let's face it, the ultimate success is being able to inspire other people based off of what you have done. So that starts tomorrow. The enrollment ends tonight, but there are still spots available, and I'll talk about that in more detail at the end. And I just want to say I'm excited to see the results of everyone that's going to be in that course. I love seeing the kids at the graduation saying, "That's my mama going across the stage." Like, I love it. That's what it's all about. So I do want to see who is in here. If you could put in the chat, if you can put in the chat where you are in your nursing journey. If your goal is to be an LPN, an RN, or a nurse practitioner, or a DNP, a doctorate nurse practitioner. I also want to know if you have applied, if you have been accepted. And while you're putting that in, I just want to say, if your program is 1 year, just commit and get it done. Your program is 2 years, just commit, get it done. 4 years, commit and get it done. The time is going to go by no matter what. So you might as well have a degree at the end of that time. So that is really, what this is all about. You want to get to the next level, you're going to have to make the sacrifice. So I'm excited to see everyone go to the next level and get their nurse grind on. Put in the program also, put in the chat, what type of program you're pursuing. Is it going to be a traditional program? Okay. So I see that. Hello, nurse practitioner. You're going to apply. That's coming up. That's coming up. So is it going to be a traditional program, an online program, or a hybrid, which is going to be like a mixture of the two? And a lot of people don't know, but your online program still requires some face-to-face clinical portion of it because you have to, have skills. So, okay, cool. That's fine. If you don't know, that's fine. I do encourage you to double check what your program is going to provide for you, what they will expect you to provide, and just make sure you're clear on the expectations of the program that you choose. That is awesome. I'm going to take a drink of water real quick. All right. So pat yourselves on the back because you are making it happen. Let's go. Let's go. So I want to recap tips 1 through 4. Tip 1 was, what is the reason that you want to become a nurse and why is this important to you? So that reason could be based on an encounter that you had with a nurse. Your why is really something you need to identify now because your why has to be bigger than you, and that's what's going to pull you through on those days of nursing challenges.
It's right.
The other tip number 2, was about finances. I talked about how you're going to finance school and how you're going to handle your personal finances so that you're not stressed out while you're in school and you can focus on nursing. Which leads us into tip 3, which is focus, not letting anyone distract you from your goal and your mission. And that was super hard for me. So that was like a very important tip. And these tips are not in order of importance, they're just tips. Number 4 was prioritize and plan. On this one, I just wanted you to take the time before you start your program to see how your time is going to be allotted with the program, and then give you some tips on how to manage your time. And some of that includes saying no. No, ma'am, I cannot do that. No, sir, I cannot do that. And being able to do it without guilt because this is your journey. So let's get right into the new tips, 5 through 10. And on 5, I do want to say that this is about study habits. Some of you may not know that when I was in nursing school, I had children. I had 2 children, and my last semester, I was pregnant with my 3rd child. And so I had to be creative when it came to studying. So I studied with my kids, and they thought we were just playing and having fun, but no, they were actually spending time with mommy, and I was spending time with them, but I was using them to like do my assessments. I was listening to their breath sounds, listening to their lung sounds, listening to their bowel sounds. And when I had a project that had a poster board involved, we were all doing that. So essentially, you could say we're all in nursing school. And that was, killing 2 birds with 1 stone. They were spending time with mommy, and I was studying. I was doing my assessments on my kids. So that's how creative you have to be sometimes. The other thing is when I had to do my papers, sometimes I had to wait until they were asleep to do those. And that meant that I was up till like 3 o'clock in the morning sometimes. But what drove me to do that was I hated that pit, that big, deep pit that you get in your stomach when you really don't feel good about something. I never felt good about not having my homework and not having my papers and not pulling what I need to pull out of those assignments. So that drove me to stay up after they went to sleep so I could complete my assignments. Failure wasn't an option for me, and I held myself to a high standard because I knew I wanted to leave that program with everything that I could so that I could be a successful nurse. And you're going to have some of your classes are going to be instructional, which is going to be like a lecture type of environment. You're going to have a skills lab, and then you're going to have clinicals where you're actually like in the clinical setting for whatever rotation you're in. So I would also tell you that when you get ready to go to your clinical rotations, take what you've learned in the class and imagine what that patient would present with. So when you go to the clinicals, you're already your learning experience is more focused and you gain more from it. And I want to share my screen for a second because I came up with some practice patients so that you can kind of get an idea of what you might be dealing with. So let's go here. Hold on. Okay, let me get my screen to share. I'm sorry, I'm taking too long. I'm trying to. Hey, Anna, thank you for joining. Let me share my screen. So we'll go here, there, and go to, okay. So, uh, okay, so in your medical surgical rotation, you may have a that's going to cover like just general medical and surgical issues that you may see in the clinical setting. So this is a typical patient that you could see in your medical surge, your med surge rotation. So we have Mr. Don had a bad day. This is a 50-year-old male. His diagnosis is nausea and vomiting. His complaints are he's been nausea and he's had nausea and vomiting for one day. He woke up busy today and just decided to come to the ER. So when you're in class getting your lecture and you're getting off details about med surg patients, I want you to start thinking about, okay, if this person comes in, they've been doing this for a day and now they're dizzy, what should I expect to see with their vital signs? So I have some examples here. Blood pressure on Mr. John had a bad day is 100/80. His pulse is 120. Respirations are 22. His temperature is 98.6. So those are vital signs you could expect to see when someone might be getting dehydrated and now they're starting to have symptoms of dizziness. Blood pressure is going to be a little on the low side. Pulse is going to be elevated. It's over 100. Respirations are going to be a little elevated. Temperature is normal because they usually don't have a fever unless they have some type of infection process going on. What would you expect to see with their lab? So they're going to do, lots of lab, but just to keep the example simple for today's purposes, they may have an elevated sodium level or an elevated BUN. And then you're going to have to use your critical thinking skills that you are learning to sharpen in nursing school when you get in the clinical setting. So you're going to be asking yourself, why is this happening? You're going to be asking, when was the last bowel movement? Because you're throwing up and you're nauseous. So let's see what's been going on in the other area of your bowels. Let's say he tells you, I haven't had a bowel movement in 5 days. That's going to be a red flag for you. You're gonna have concerns. You're going to feel like this might be related to him having an impaction of stool. He may be constipated, and if there's nothing going out, it's going to start coming back up. So you're going to start throwing up. You may ask him, has your diet changed recently? What medications are you on? Okay, he just told you, oh, I had a tooth pulled last week and the dentist gave me some Lortab. Lortab causes constipation, and that could have triggered this whole thing, and now he's, having nausea and vomiting. So that's just an example of how you need to be in class thinking along those lines so that when you get to the clinical setting, you're gaining the most that you can from that experience. And I'll stop sharing my screen and go back to the notes. Actually, we do have another example, so I'm going to share my screen again. So let's say you're in your OBGYN rotation, and this is a patient that shows up and you happen to be a clinical. So based off what you learned in class, this is what you're going to be thinking about. Okay, this is Brenda got a baby. She's 23 years old. She's at 38 weeks gestation, and this is her third child. So a normal gestation for delivery is going to be anywhere from 38, well, sometimes, depending on the doctor, could be 36 to 42 weeks. So she's within term, full term. Her history is other deliveries were vaginal. Okay, this is probably going to be a vaginal unless there's some type of emergency. Then you're going to have the current situation. So she doesn't have an epidural. She's dilated to 10. Her amnio sac is intact. Contractions every 10 minutes and lasting 2 minutes. And fetal heart rate is normal, and she has been in labor for 24 hours. The vitals are stable, and doctor is on the way to induce her labor. So as your critical thinking skills are sharpening and you're getting more involved with what you can expect, what you've learned from class, and what you're going to take to your clinicals, what medications are you expecting to be ordered when the doctor gets there? What changes do you expect to see once the medications start? This is all what you've learned in class, and now you're in the clinical setting using that information. What do you need to report to the doctor when he or she gets there? So just wanted you to know that's kind of how you have to approach your studying so that you can get to the best, basically get the best experience you can from the nursing program. The other thing I would say about study habits is save your books. I was able to sell back my books for my prereqs, but I kept all my nursing books, and I did use them after graduation. So you will too. I saved the books from my BSN, and I saved the books from my master's as well. So that is it on study habits. Do you guys feel like this has been helpful? Are you can you put in the chat if you feel like this is really helping you kind of get your mind ready for nursing school? And if you don't know how to use the chat, if you just kind of put your mouse towards the bottom of the screen, you'll get like a menu that pops up and you'll have chat there. And you can type a message in there and just make sure that, okay, good. Okay, we'll go to tip number 3. I'm sorry, tip number 6, which is testing. So testing skills. In nursing school, there are lots of tests. And then once you get through all the tests in nursing school, then you have the big test. This is your board exam with your state. I'm in Oklahoma, so my test is going to be with the Oklahoma Board of Nursing. Most of the tests that you have in nursing school are going to be multiple choice. And the way to approach it is, out of the 4 choices that you have, 2 are definitely going to be wrong, and 2 are going to be possibly right, but one's going to be better than the other. So what you want to do is approach those answers with ruling out the ones that are wrong first. Get them out the way. Then go to the 2 that could be right. Look at them, go back to your question, and then decide what information is there that you didn't get the first time, and then decide which answer is best. I'm going to share my screen, and I have an example of that, of a test question. Okay. So you have the test question. This is a sample question, and it's simple because we just don't have a lot of time today. But you find your patient unresponsive. You notice blood draining from the surgical wound on their right groin. What do you do next? So your choices are: put a dressing on the wound, B, call for help, C, perform a sternal rub, or D, give them their morning meds. So which 2 are you pretty much know? You pretty much can figure out they are not right. So because I'm sharing my screen, I can't see the chat, but I'll just tell you that putting a dressing on the wound is definitely going to be wrong, because they have a loss of consciousness, and you're not concerned about a wound. You want to get them stable. So that's wrong. Oh, sorry. Then you have give them their morning meds. That's definitely wrong. If someone's unresponsive, you can't give them any meds. So let's rule those out. Let's go back to the question. You find your patient unresponsive. You notice blood draining from the surgical wound on the right groin. What do you do next? So of the 2 answers you have left, are you going to call for help or perform a sternal rub? And for those of you that don't know, a sternal rub is someone actually rubbing on your chest bone, and that's how you stimulate someone. If they're not responding to you calling their name, you do a sternal rub, and if they don't respond, then they are unresponsive. So at this point, you've already been able to assess for responsiveness, and they're not responsive. So at this point, you want to call for help. So that would be the best answer out of the answers there. And that's really how you're going to approach the test in school and when you do your boards. But I will tell you, as far as your board test, it can be anywhere from 75 questions to 265 questions. And each question that you get is going to be based off of the previous answer that you provided. And that can really, it has some logic built into it. So that can really make you can't think about anything but just the questions. Because if you try to think about, oh, I think I got that right because this question is a little bit easier, or oh, I think I got that wrong. You just have to take your test. When I took my test, I was in the parking lot trying to talk myself out of going in there because I was like, I think I need to study some more. So I went and tried to reschedule my test. And when they told me there was a fee to do it, I was like, oh no, I have to take it because I didn't have any money available. So I had to take it. And when I took the test and it cut off at 75 questions, I started freaking out because I was like, either I did really good and it feels like I'll be a good nurse, or I did really bad. And it's just like, no, we're not giving you more questions. You're totally screwed. So just beware that you can be there for hours. I think you can get up to 4 hours to take the test, or it could be a quick test for you. So that's it on testing. Do you guys think that was helpful? Do you think you gained something from that tip? And you can just put it in the chat and I'll keep going. Okay, cool. I'm glad you are finding this helpful because I don't want to assume that you are. The next tip was group work and group presentations. In nursing school, and when you start practicing as a nurse, you are going to have lots of group assignments and you're going to be working as a team. Healthcare is pretty much teamwork. So I want you to just think about how you can sharpen your leadership skills, because when you're in a group, what I found more helpful was I would take the leadership role, because if you don't do it, then somebody's going to end up telling you what to do. And you just have to sharpen those team building skills so that you can get people to do what you need them to do at the time it needs to be done. And that's what's going to set you apart, when you're in those assignments, because you're going to be learning how to delegate tasks. As an LPN, RN, nurse practitioner, you're going to have to delegate tasks to other people. And as a nurse practitioner, you'll actually be able to order things on the patients. So whether you're running a code or you just having somebody take care of some personal care needs for your patient, you will be in a team role, and you would need to know that your leadership skills are going to be proficient enough for you to take care of that patient that you're taking care of. So that's I just wanted you to just be prepared for lots of group work and teamwork and sharpen your skills. So let's go to number 8, self-care. So you as a nurse, future nurse, aspiring nurse, current nurse, you are going to be all about taking care of patients and making sure that your patients get what they need. But we do not do a good job of taking care of ourselves. And so as nurses, you have to be constantly reminded to take care of yourself. In nursing school, your class days, your clinical days, your group days, you are going to be stretched very thin. So I would encourage you to get enough rest, get proper exercise, and eat healthy when you can. Because I know sometimes you're on the run and you just cannot do it. What I did is I tried to meal prep, but I mean, sometimes you still just have your cheat days and you eat what you want to eat, and it is what it is. But if you try to plan, you're going to save money and you're going to eat better, because after you eat so much on the go, your body just starts telling you just don't feel good. You don't feel like you're your best and you can be with your A game. So you'll have to make steps to be intentional. Plan your meals, plan your snacks. I've gone back to that. It was a money deal back then, but now it's like, no, I want to eat better. I want to give my body better nutrition. And as a nurse, we just don't think about ourselves. We're too busy thinking about other people. And if you're a mom, you're too busy thinking about your kids. You don't think about yourself. And this is just an example of how it could happen. So as a nurse, you're taking care of your patients. If your patients go throughout your whole shift without urinating, you are going to do something about it. You're going to be calling the doctor. You're going to be on top of it. But guess what? You will go 12 hours without urinating. It's not that you're trying to. It's like you have a nurse brain, and the brain just doesn't even let the the urgency come to you at all until you kind of slow down and you're getting ready to go. Then you're like, oh crap, I went 12 hours without urinating. And I would tell you from a urologist that I know that you should be voiding every 4 hours. Your patient should have at least 30 cc's of urine per hour. So you're going to be watching that and you're going to be recording that. And if that misses a mark, you're going to be on top of it, but you're going to do it for yourself. Don't ask me why. But I do know that nurses, we have what you call a nurse brain, and we just forget about ourselves. As far as exercising, when I'm on top of my game and I'm doing my cardio and I'm doing my strength training, I am just breezing through my shift. I'm pushing beds, I'm pulling people up, I'm able to do CPR on somebody for as long as I need to. And when I'm slacking and my body is not in tip-top condition, I can tell I'm not able to do those things at the performance level that I want to. So just keep that in mind. Self-care while you're in nursing school and when you graduate. And let's see. Let's talk about the next tip, which is legal concerns and risks. So with the legal concerns and risks, just know that you have to know and understand your scope of practice as a nursing student and a practicing nurse. There are so many situations every day where there are like medical errors, where patients are like dying, and it's someone else's fault because you're not ordering the medications. But what happens is you have a doctor write the wrong strength for a patient. Okay, that order goes to the pharmacy. Pharmacy misses it. They fill the medication. So they send it up to you on your unit. You're taking care of that patient. You give it. You are the last line of defense for saving a patient's life. So keep that in mind. Everybody can make mistakes, and their mistakes can slip by, but when the mistake makes it to the patient, it turns into the nurse's fault because the nurse should have did the rights of medication administration or whatever. So just keep that in mind. And if you're like me, where I just wanted, to be a nurse, I didn't have a plan B. You want to protect your license. You worked hard for it. You had to do all this to get it done. Keep your license and protect it. And the other thing I would say about legal is don't cut corners. There are processes set up in the facilities to protect the patients, and a lot of nurses get frustrated with those, and then they start cutting corners, and it puts the patients at risk. So if the process is to get one dose of insulin out at a time, just get one dose. And that way you don't even get to mix up insulin doses and give the wrong patient the wrong dose. And right now, like, nurses are getting criminal charges for when patients die. There was a case just not too long ago where the nurse gave a paralytic drug instead of a different kind of drug for a procedure. They were having an MRI and they were claustrophobic, and so she gave the paralytic, which means it paralyzed the patient. Nobody knew. She bypassed scanning the medication and scanning the patient, and so that she bypassed that safety process there, gave the medication, the patient died, and now she's facing charges of negligent homicide. Like, that could have been avoided if we just pay attention. And so I'm telling you now, not to scare you, but just to keep you focused. Like, don't do anything you don't know how to do. And doctors will actually do some things that you don't know how to do. And as new nurses, we tend to be timid and kind of fold under that pressure of, well, can't you do this? I'm giving you an order. No, you tell the doctor you don't know how to do that, and you'll get someone that can help them. Because on the stand, when that case is being heard because of malpractice or whatever, the doctor's going to say, I didn't know she couldn't do what I asked her to do. You did it. Now somebody's dead. I mean, you just don't want to be responsible for anything like that. So just know your scope and stick to it, and don't let anyone persuade you or any situation get you out of your safety zone. The other thing I want to say on legal concerns and risk is document. If you didn't document it, you didn't do it. Make sure your documentation paints a picture so that no one has any questions about what happened during your shift. And care plans are a big deal in nursing school, but not so much in the real world. So just get your care plans down, get your foundation, Make sure you're doing everything your instructors want you to do, but just know that you're going to do them after you graduate, but it's not going to be a big deal like that. Okay, that's it on that. Are there any questions about that? Let me pull up the chat box. And we'll have some Q&A in just a little bit because we only have one more tip and I'll be able to do some Q&A. Okay, so I'll go back to the last tip. So the last tip is get involved. When you're in nursing school, join the Student Nurse Association if you can, because I know we all have a lot on our plates. And that will kind of set the stage for you being involved as a practicing nurse, because you'll want to join your local nursing state chapter. And if you specialize in a certain area, like I'm an occupational health nurse, I have certifications, several certifications in that, then you also want to join the association for your certification and be involved. Because let me tell you, it's not just about going to nursing school and getting a check and being able to take care of your family. That's important. But if we as the practicing nurses don't move the profession forward, then we are in trouble, because we're able to do what we're doing today because the nurses before us made sure the profession was significant and moved forward. Internationally, I found out just from being involved with different associations that the registered nurses, like in Europe, they are writing prescriptions just like we go to the doctor and get prescriptions. They're doing it as nurses there because those nurses made that happen. We can't even get all the nurse practitioners to have independent practices. They have to be supervised by doctors in certain states, and Oklahoma is one of those states. So we just have to make sure we are not just doing our own thing in nursing, but we're looking at the profession as a whole, because we are the ones that are going to keep nursing significant and keep it progressing to the next level. So that is my last tip. And now I just want to take a minute to talk about the other thing that I have going on that I talked about in the beginning. The 30-day online course is called From Survival Mode to Living Your Best Life. And this program starts tomorrow. I'm so excited because it's my first class, and I'm just gonna treat them real special. But it's my first class, and it's really geared towards people that feel stuck and want more out of life, to stop the habit of procrastination and end the vicious cycle of poverty, feel more fulfilled in life, and build a legacy that inspires others. Because the ultimate level of success is being able to inspire others. And I'll just say it, I've developed a WIN system, W-I-N system that I use. I was my first student. As a teenage mother, giving birth to my child at 15, she was 10 weeks early. I was not supposed to be anything. I was supposed to be nothing. I was supposed to be dependent on the government. And I broke out of that mold that society was telling me I needed to be in, and I made my own mold. So I just want to just help other people do that. And once you use the system to crush your goals, you can do it over and over again and show your kids, so we can break the cycle. Show your family. It's all online, so you can literally like be in your pajamas and still be learning and getting jewels that you can use. But we have some modules here, and then these are the kind of results. This is an example of what could happen. I worked with someone in Sacramento, and she used the system that I'm going to be teaching in the online course. She was able to save $20,000 on a $40,000 salary in 1 year. And that's just from going to bare bones because she knew what she needed to do, and I was coaching her along the way. So now that she's done that, now she's taking steps to open an assisted living with 6 beds. That's her passion. She wants to do that. And that's just the first home, because she'll do more after that because she has drive. She's a go-getter. So the program taught her how to budget and get that savings up so that she could actually make some power moves and make some boss moves. So that's one example that I wanted to share. And I guess I need to go down. Just some more details about it. It's a 30-day online course. The kickoff is tomorrow. And it's a weekly hour class. Like I said, online. You'll get your personalized action plan after that. You'll have lifetime access to me in our private Facebook group, and we'll have weekly live Q&As in there. Just go to live Q&A, and you are crushing it. The little zebra dancing right there. So if you have some questions, let's put them in the chat. Okay. Not sure what's going on there. There we go. Yes, the legal responsibility is scary, but you will have the tools that you need, and you'll understand what your scope of practice is, and that's going to protect you. If you just stick to what you need to do, understand your limits, you'll be fine. Anything else? That was a good point. It is scary. That's why when somebody's like, "Oh, can you do this or can you do that?" and you know that it can risk you losing your license and actually risk somebody's life, that's why you're like, "No, no, ma'am, no, sir, I cannot do that." But I'll get you someone that can help you, or I can get you someone that can explain why we can't do that here in this facility. So, anything else? I really appreciate you guys joining. I know, you have 1,000 things you could be doing. I appreciate it, and I'm excited for you on your journeys. You are getting ready to crush your goals and get to the next level. It's yours. You can do whatever you want to do. The limit is whatever you want it to be. And I do encourage you to just keep making new goals. As you crush them, make new goals. I'm excited too. I'm excited too. So if that's it, I will end the Zoom class. This is being recorded, so I'm gonna try to do some editing because the first video needed some editing. I didn't get it done, and it's still up there. I'm gonna put it on my YouTube channel, Jamesha Ross RN, and it'll be available. And then again, I'm gonna be having the ebook out in probably 2 weeks, and then that'll be available too. And that'll probably be a freebie just because I just want to share, because people are always asking me, how did you do it? I have kids. I can't go to nursing school because I have kids. Yes, you can. Your kids are your motivation. What do you mean you can't go to school because of your kids? So, like I said, me and my kids went to nursing school. They just didn't get to take the test, but they were learning right along with me. So, I guess if that's it, I will go ahead and end the Zoom, and thank you again. And you can reach out to me on Instagram or Facebook or email me I'll put my email in here so you can see that. There we go. So that's my email. Be sure you can copy it and paste it out of the chat if you want to. Or like I said, just hit me up on the DM or the messenger. I'm learning. And thank you again. Bye-bye.